During the winter, we see a ton of flare-ups from patients who suffer from sinusitis. Until now, there have only been a few solutions, but a new surgical procedure called balloon sinuplasty may finally bring some relief for people who are sick and tired of feeling miserable.
I've had acute sinus infections off and on for 20 years. I have a headache all the time. I have chronic fatigue. In the winter months, these symptoms get even worse. The air's drier, the sinuses can't drain, there's more pain, and it's just much more miserable. I've tried all kinds of holistic and traditional treatments. Antibiotics are not working, so I'm here to have a balloon sinuplasty.
We're going to address those blocked sinuses. We're going to use balloons that we're going to gently place into your nose. We're going to inflate those balloons where the sinuses are blocked. They're going to gently crack the sinus bone and allow the bone to heal with the sinuses open.
This surgery is very, very important to me. It will be life-changing.
Karen's had sinus problems as long as I've known her, especially in the winter time. We're really eager to have this procedure be successful.
That little balloon can generate enough pressure to move and break bone. I have the frontal guide, please. I'll be watching on her face and looking for evidence of my light entering into the target sinus. We are actually exactly where we need to be, which is in the sinus right above her eye. I'm actually passing the balloon into my target sinus of interest. And let's go ahead and inflate the balloon now. Okay. Go to 12, please. Now the balloon's fully inflated. It took about 5 minutes to treat the first sinus, and we'll head over and do the other side. And we'll really get the maximum utilization of the balloon technology here. We've treated the sinus of interest. I think she's going to do really, really well.
Joining us is ear, nose, and throat specialist, Dr. Brian Weeks, and his patient, Karen. Welcome. Thanks for coming. So, Karen, tell me, how do you feel?
I feel much better. There was tremendous improvement the day after the surgery.
I know this has been an ongoing condition for you for years. You've tried medical treatments, and you went under more aggressive surgery as well, correct?
Yes, I had traditional sinus surgery 4 years ago. 4 months later, I was still in pain, and it was about 6 months before I felt really good. There was less pain the day after this surgery, and a week later, I'm feeling really good.
So, doctor, tell us exactly what you did.
Well, basically, we went inside Karen's nose. We used this technology with the balloon to gently inflate the sinus that's blocked. And basically, we did that by putting the balloon in an appropriate position, lining it up in the area of the blockage, and then gently dilating or opening that block passage. And by doing that and not cutting and tearing, we're allowed to allow people to recover much more quickly, get back to work quickly. And it's been an unbelievable experience for the patients.
Right. For everybody out there, we have air spaces in the bones of our face called sinuses, right?
Absolutely.
What do? Well, they help to keep our head actually lighter, so there isn't as much weight. Also resonate and to just help the nose filter.
For talking and hearing as well.
Exactly. But we get into trouble when those little openings that communicate from the nasal passages to the sinuses get blocked, and it all starts with that, correct?
Absolutely.
Can you show us exactly what you did here?
I sure will. So basically, the balloon is positioned appropriately in the nose. It's lined up in the area of blockage, and this is actually where Karen's sinuses were blocked. And so I'll just gently begin to move or dilate the balloon, which will gently open that blocked sinus passage. And as I inflate the pressure in this device, the balloon will gently dilate that tissue. And it'll do it in a way that it'll gently reposition the blockage and allow it to heal in an open position.
Well, this is a neat new procedure. Do the winter months get you down and make you feel sad? Well, you're definitely not alone. And Mary from Lawton, Oklahoma, sent us a home video hoping that we can cure her winter blues.